Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
So Dr. Jabour, we have talked about the necessity of a fever, but how does the body raise our temperature? And what are the times during the day or the night, I guess, when this fever will actually spike, and why?
Okay, what happens is that we have a thermostat in our brain that controls our body temperature. And when infection is there, our body has the ability to adjust that thermostat and raise it as necessary. So what will happen is that as the germs multiply, the body will raise the temperature, and then it'll raise the temperature at 2 times in particular. It'll raise the temperature usually between 6 and 9 o'clock at night and between 3 and 4 o'clock in the morning. And what that does is, this is directly related to something called our diurnal rhythm, or our body clock. Our body clock is why we are awake in the daytime and asleep and feel sleepy at night. And so at those 2 particular times, the body will spike the temperature quite high to get the germs under control. And of course, that is the most worrying time for most parents, because it's usually in the middle of the night and no help is available, nobody to call, no doctors to call, and it's usually a very terrifying time for most parents.
As a parent myself, I can identify with that. Now, one of the other challenges that I think I've had and most parents have had is, what should we be feeding the child at this time? There always seems to be some confusion about what we want to feed and what a child is actually going to tolerate.
What we come here to is the basic maternal instinct. The basic maternal instinct is that the mother likes to feed the child. She feels very happy when a child is eating. Now, if you think about yourself, when you have a virus or an infection, do you eat? No. Okay? And so to expect your child to be eating at that point in time is unrealistic. What he's going to need, his body is going to need fluids. Okay? Because when you have a temperature, it uses up water within your system. So the child is not going to want to eat any food. He's going to want water, he's going to want juices, he's going to want coconut water, that kind of thing.
Okay.
They actually did a study that showed that people who have virus infections, if they drank chicken soup, they got better faster than the ones who didn't take the soup. And so that's one of the things I encourage parents to try and get the child to take a little bit of chicken soup.
Okay. Now, you've talked about fever, how the body raises the temperature, and why a fever is important. But there are times when we will give medications to not allow the fever to get too high. What are those circumstances where it's necessary to give medications for the fever, and what are some of the medications we give?
Having said all that I said about a fever, you'd think it's strange that we'd want to give fever medicine. But in fact, you're dealing now with a child, and a child is now maturing. His brain is now maturing, and it hasn't developed properly as yet. And so it's not functioning at 100% the way it should. And what happens when they have a fever is that the brain gets very irritable. And so what can happen in some cases is that they can get something called a febrile fit. Now, a febrile fit will usually occur sometimes in the range of 6 months to 6 years is the average time. They're usually very short-lasting, very brief. And long-term, it doesn't cause any harm, unlike epilepsy or one of those type of diseases. And so because of that fact, if you see a child being irritable and looks like he's hallucinating or something like that, that would be the time you'd want to bring that temperature down and reduce the irritability of the brain. You asked about
the type of medications.
The type of medications. The standard type of medications are what we call antipyretics. The word pyrexia means fever in medicine. And so anti would be something to bring it down. And the 2 basic ones that we use are basically the ibuprofen group of medications or the paracetamol type medications. Now, paracetamol is the British term for the drug. The American term is acetaminophen. So people got to be aware that the 2 names, while sounding different, are actually covering the same type of medication. Okay. And those 2 types of medications is basically what we use.
Now, in addition to medications, are there other measures that a parent or guardian can use to help lower this temperature when it's getting into that range that we don't want?
Yeah. if you're seeing that the fever medicine is not being effective, then what you can start doing is some mechanical methods. And one of the things is to cool the body down. And the major part for a child that you want to cool is his head. And so you can use cold cloths, apply cold cloths to the head. Sometimes people try and use alcohol. And so alcohol is not really recommended because of the fumes that are involved. But you need to bring mainly the brain temperature down so that it doesn't get so irritable. But the other thing that you will do is you can cool the body down. And this is where a mistake is made, whereby they're trying to use cold water to cool the baby's temperature down. What we use is something called tepid sponging. The word tepid means warm. And what cools the body down is the water evaporating from the body. That takes the heat away from the body. And so you want the child, if necessary, sitting in the bathtub with the water just above body temperature. Above all, he must not shiver. If he shivers, the water is too cold. When you're shivering, you generate heat, and so you're defeating the purpose of trying to lower the temperature.
Okay. What is the natural course of a fever?
Keeping in mind what I said before of how the body works, what is going to happen is that between 3 and 5 days is when the body is building up the antibodies needed. By the time it comes to the 5th day, the use of the fever is no longer necessary, and so the body no longer needs the temperature, and the temperature will usually break. Now, there are viruses and diseases that will allow the temperature to go, that the body needs the temperature for a longer period of time. So if you get a temperature going to 6, 7, 8 days, it's not a rare or unusual thing, and it will depend a lot on the type of virus or infection that you're fighting.
Now, this is obviously going to make most parents and guardians very nervous. Their child is having a fever. As you mentioned, when it's going to spike is mostly at night. There isn't, the pediatrician is not there on the phone. What should the parents be looking out for that will make them decide you need to come to the emergency room, or you need to get on the phone and try to get down to your doctor?
Okay, most people get hung up on the actual fever, the actual temperature. That's not what is important. The temperature has to be there. The child has to survive. What is important is how the child is behaving. Now, there are two basic types of situations that you'll look at. One is the child who's got a temperature. It's reasonably hot. When you put your hand against his forehead or his neck, he's quite warm. But when you look at him, he's active, he's playing, he's looking around. He's ignoring the fever, okay? His body knows that it needs the fever and it's using it. That type of child, you can wait and see, you can watch, because the mechanisms that are going on are what nature has in mind to make him survive. The second type of child is going to be the one who you've given the antipyretics, an hour or two has gone by, you've given both antibiotics together, not much effect, the child remains lethargic, he's not looking around, he's clingy, he's staying near to you, and he's hugging you, and doesn't want to eat and doesn't want to take any fluids or anything. That child I want to see.
Okay. So today we have been talking with Dr. Rohan Jabour about fever in children. And so we're going to ask Dr. Jabour at this point to summarize what are those key points he would like the parents and guardians to remember. Dr. Jabour, what are some of those key points you would like our listeners to remember?
One, fever is not something to be afraid of. The germ that's causing the fever is the problem, okay? And the fever is an essential part of your immune system. And so if a child gets a fever, don't run to the doctor the first 24 or 48 hours. Look at him. Look at what he's doing, how he's behaving, okay? He has approximately 200 cold viruses to meet in the thing. So he's going to get lots of fever in the process of growing up, okay? So when you see a fever, no harm in giving him some antibiotics, but don't keep playing with it. The first sign of it is slightly warm. Give nature a chance to do its job. It needs to do that. Look at your child, see how he's behaving, and go according to what he's dictating to you. And he'll tell you, okay? Just be aware that between 6 and 9 o'clock at night and 3 and 4 o'clock in the morning, it's going to be high, it's going to spike, you're going to need to cool his head down, you're going to give him TLC, and you've got to be a parent to him and bring it down.
And that brings us to the end of the first segment of today's program.